Hello. Right, everybody ready to go? Did we have somebody just... there she is. Are you all right? Right, welcome everybody. We're going to get into paediatric talk. First off, we know babies cry. So if anyone kicks up a fuss, don't worry, I can deal with it. So it's not going to put me off any more than I'm already put off already. So yeah, feel free to settle them in here or go out if you need to. Don't worry about it. Okay? Go on. Baby change downstairs. Well, perfect timing that, wasn't it? Yeah, there is one on the downstairs toilet right next to the stairs. Okay, so first off, I'd like to say that I'm not very technologically apt, so my presentation is quite basic, but hopefully the content will make up for the visual. All right, but I'm hoping I've pitched it right so that you'll learn something, but hopefully it's not going to go too in depth and too over your head. But there'll be a chance at the end just to ask some questions. Being a typical man, I can't do two things at once. So if you can make a mental note of them or write it down, there'll be some time and I can hopefully answer anything that you need to know. Okay? So, first off, I'm not very egotistical, but I think it's important just to get a background of who I am and why I do pediatrics. So, I had my first chiropractic adjustments in 1994 when I was age 13. I was awaiting a trial for the British gymnastics team, so it was a really important time, and all of a sudden developed a really bad back. Went to the doctor. The doctor, well, helpful as they were, couldn't really fix what I needed to do. He mentioned going to see a physiotherapist. So I went to see a sports physiotherapist. And again, really helpful, but just didn't get to the crux of it. And then I went to see a chiropractor on the recommendation of somebody. Never heard of a chiropractor before. This was before internet, social media. It was very unknown. But I went with an open mind. My mum took me, and the guy I actually saw, lovely guy, from Iran, and his English was good, but he wasn't perfect English. So when he was explaining about what to expect, we kind of got a bit of a mixed message, and he did my first adjustments. There was a almighty cracking sound. My mum panicked, jumped off the couch, and I got off the couch and said, no, feels better. So from that point, I just wanted to be a chiropractor. So back in the 90s, the only place that trained people was a place down in Bournemouth. It was a private institution. It was going to cost about £40,000, which 30 years ago was incredible money. And my mum basically just said, no, we cannot afford it. So I put it out of my mind, went on to do an engineering course. And then I was going to leave and do an engineering degree, looked into chiropractic again, and then managed to find a place that wasn't going to cost that amount of money. It was a 5 years master's degree. So I went at 22, graduated at 27. By this point, everybody I knew had houses, was settling down, and I was still a student. So it was quite an undertaking, but it's the best thing I ever did. So I graduated in 2009 from the Welsh Institute of Chiropractic, which is down near Cardiff. And just to show that I'm not faking it, here is me. Looking very young and innocent, but this is my last clinical year down in Wales. And this guy, believe it or not, was the Iranian chiropractor who treated me all those years ago. So it kind of came full circle. He was actually being one of the tutors within the university. So getting on to pediatrics. So my pediatrics journey started when me and my wife were expecting our first baby, which was in 2014. So I kind of was panicking a little bit and thought, right, I best know a bit about babies and what to do. So I did a postgraduate course with a guy called Steve Williams, who is a pediatric chiropractor down in Southampton and Bournemouth. So he offered courses both in Southampton and in Barcelona. Now, I didn't tell my wife that Southampton was an option, so I went to Barcelona for the weekend. So I went to 4 weekends over in Barcelona to do the crux of my training, and it included pregnancy, how to treat the pregnant female, the birth process, birth trauma, and then getting into pediatric care and then childhood illnesses and diseases. And ultimately, this was the core kind of impression that I wanted to do. Is I wanted to make sure that I was able to look after my family it wanted to be in a safe and effective way without always going towards that healthcare paradigm of drugs and surgery and those kind of things. So my kids, Ruby, who was born in 2014, I'm just going to run through both of their kind of early stages just because it is quite relevant. First of all, really healthy pregnancy. My wife kind of breezed through pregnancy. It was really, really good. And we thought, this is pretty good. This is easy. Kind of lulled us into a bit of a false sense of security. We had all these impressions of birthing pool and nice music and relaxed environment. Being the first pregnancy, my wife wasn't 100% comfortable with having a home birth, but it was kind of on our agenda for subsequent babies if we ever had any. And then we ended up where my wife's waters broke about a week after a due date. And we thought, yeah, we're on track. We were ready to go. And the contractions just didn't start. And it was about 24 hours later, so nothing had happened. So I went to see the doctor at the hospital, and they basically said, yeah, there's a high chance of infection. So unless things happen pretty soon, we're going to have to induce you. So we kind of got onto that and accepted that we need to do what we need to do. Again, she sailed through kind of the labour process. She was going really good, just sort of coping on gas and air. And then she was sick, and she became dehydrated, and her contractions just stopped. So from that point, we then had to have a bit more intervention. So we had the drip to start off those contractions again, and then ended up with a forceps delivery. And at the beginning, like I said, we had all of this kind of impression that we didn't want to have any intervention, wanted it really natural. But you can't kind of pick and choose these things. They just have a habit of dealing you what they deal. So, but we kind of took it well, and it was safe. Everybody was healthy at the end of the day. But when I first assessed her, because I'd just done my training, got given Ruby, and I had a look at her neck. She had kind of forceps marks down here and down here, bless her, really kind of swollen face. And when I had a feel of her spine, the upper neck was just really tight. And when I kind of moved her head one way, it kind of felt really free, moved her head the other way. And although she wasn't crying, there was a lot of kind of resistance there. So I didn't really think twice about it. I just did a few little adjustments and it seemed to free off, and never really had any problems after that, which was fantastic. And from that, textbook childhood, really healthy baby. We got to Ruby being about 3 or 4, and we thought, right, ready for another one. We've aced the first one, it's easy. And then we came on to so this is Ruby. She's 12 now, and this is my 2 loves in life, family and Newcastle. I won't tell you which one's ahead of which, but you can probably guess. My second child, so this came to Edie. So Edie was born 4 years later, 2018. And because of the first experience, it kind of reinforced it that we wanted to go natural and we wanted to have less intervention. And by this point, my wife was quite happy to have home birth. So we'd kind of looked into that. But it turned out to be a very different experience. So right from the off, from kind of 12 weeks, you have the scan and they do the blood test. It identified some problems with the placenta attachment. And the risks of this were preeclampsia, early delivery, and low birth weight. So we had to have these ongoing checks just to make sure that things were progressing well. And we got to kind of 34 weeks and things were still pretty good. And we thought, right, if everything's okay today, we're just going to say we don't want any more. We're going to go ahead with what we want to do. But then we went for the scan at 34 weeks and everything had kind of slowed and dropped off. So the sizes, when they're making measurements on the scan, everything had dropped off. And they pulled us into a room, the chat that nobody wants to hear. And they basically said, look, we could do with getting the baby out in the next week or so. It's we need to make sure that she's okay. So we went home and we were kind of umming and ahhing about this. And then we got a phone call and said, well, you know what we said about a week? We need you in now. So they'd done some blood tests. They'd come back really abnormal and they wanted us in. So she was born 6 weeks premature, weighing £3.11, which, if you know weights, I don't know, do they do grams and pounds? Yeah. So yeah, but £3.11 is tiny. In fact, she was actually quite a decent size, but she was just very, very skinny. There was just so frail. And then my wife developed a condition called HELP syndrome, which is linked to preeclampsia, and she was really ill. I actually went home from the hospital. Everything was fine. I went to bed. I had a really good night's sleep, best night's sleep ever. Woke up, and on my phone, I had a missed call from my wife with a voicemail. I listened to that, and she said that she was feeling unwell. They're going to take her down into the labour suite to give her a better eye. So 5:30, gave the hospital a ring, said, I've just had this voicemail. And they're like, yeah, she's in intensive care. Excuse me. So I felt so guilty because I'd had the best night's sleep ever, unaware of all this. But when I got to the hospital, everything was okay. She had quite a lot of fluids and lines coming out of her. But yeah, all I can say from that is it was an extremely stressful time for both me, my wife, and Edie as well. And it turned out to be a tough few weeks because she was so little. We actually took her home and she was still only not even £4 in the car seat. And it felt like we had a newborn baby for about 7 months because everything was just getting back to normal. And even with my kind of extra knowledge, it stressed me out to high heaven. So yeah, that's the two different kind of, and that's from somebody, like I say, who's got a little bit of medical knowledge about them. So this is how small Edie was. So this is my hands and this is my wife's hands. So you can see how tiny she was. Okay, so if I get £1 for every time I get asked why do babies need chiro, I wouldn't have to work anymore. So when we have babies in reception or if they see me working on a baby, everyone comes over and says, why does a baby need chiro? And the answer is stress. The stress that I've just talked about impacts not only the mother, but also the baby. And they can't communicate this. So they may communicate this in excess crying or problems digesting food or not sleeping correctly. This is a sign that the baby is stressed. Okay. But do they really need chiropractic? Once I've talked all through that, but then it's always a question, but really, do they need it? This kind of, and this is a healthy, natural, well, natural-ish kind of delivery. You can see how much strain there is on the baby's neck. And this is a C-section with a breech delivery, and they're applying some pressure to bring the baby out. So, and this would be regarded as nothing really went wrong. So you can imagine when there is a few episodes where there's tough delivery, it puts a lot of strain onto the baby. Okay, so where does the stress come from? We talk about the 3 T's. So first off, we have trauma. So like I just talked about, by far the most common one is birth trauma. Okay, even a healthy delivery has a lot of strain. We also have the stresses and strain while the baby is inside the mother. Now, most often, if we have a problem or a change in how the mother's pelvis is rotated, it can actually cause a lot of pressure onto the baby unknowingly. So if you imagine a basket and we have the baby sitting in the basket and it's like this, and these are the 2 pelvis bones with the pelvic floor. If we have a twisting of the pelvis, all of a sudden this basket now becomes a little bit tighter and the baby doesn't have as much room to move about. And that can actually lead towards the breech deliveries in a certain amount of cases because they haven't got the maneuverability to get into the right position. But even if we do get into the head down position, there's still quite a lot of pressure. And that might be on the head, it might be on the body, it might be on the pelvis. And we see those stresses and strains after delivery. And we can kind of say, oh, did you have any problems with your back while you were pregnant? Yes, I had a lot of back pain. And it's probably because the pelvis is twisted. As well as that, we have falls. So if the mother's had any kind of trauma during the pregnancy, but also as the baby's getting a little bit older and starting to move a bit more, we get the trauma from falls. Posture, again, as we're lovely. As we're getting a bit older, and we're starting to go into crawling, we're going into sitting posture, into standing posture. These have stresses and strains on the baby. And if everything's moving correctly and working correctly, they can cope with these kind of postural stresses quite well. But if there isn't, it has more of an effect. And then as we're getting into kind of childhood and phones are getting younger and younger in kids, we see this. And I graduated in 2009, and just in that period of time, we're having kids who are having adult neck problems because of this and because of gaming. So posture and phones is a big one. Second one, we've got toxins. So with toxins, we're kind of grouping anything that's having an effect on the body chemically. So that may be from a dietary aspect. So obviously in the younger days, it's whether they have any kind of allergy to the milk or things like that. As they're getting a bit older, it might be any kind of food allergies. Antibiotic use, so both in the mother during pregnancy and in the baby soon after, can have a big impact on their gut. So we talk about gut flora and gut bacteria. It's really important for them to digest all of the stuff that they need to. And if they've got a poor gut bacteria, then they struggle with that and we see digestive issues because of that. Medications, obvious one really. It has a positive effect in one way, but it also has side effects that might impact things. And then as we're getting a little bit older, we're into the sugar and the energy drinks and the caffeine, and all of these impact the body as well. Finally, we've got thoughts. Now, when I first graduated, this would kind of feel a little bit alien to me, but the more research you do, the more it has a big impact. So right from the end of the first trimester, anything that you mums were feeling or going through directly impacts the baby. So work stress, stress of an ill family member, divorce, relationship violence, deaths, all of these things are going to have a direct impact on stress response within the baby. As well as that, obviously, when they do come out, they have stresses of everything that goes on with everyday life. Okay. Now, what happens when that stress impacts, and it can be from the physical, it can be from the chemical, it can be from the emotional that we've just talked about, it has a specific effect on our nervous system. Now, imagine we walked out of the clinic and there was a tiger running for us. Our body would react in the stress response. So our heart would beat faster. The blood would go to our arms and our legs so that we could either fight the tiger or run way away from it. It's the fight or flight response that most people have heard of. But the body reacts like that, whether it's a tiger or whether it's an exam or whether it's an argument with your partner. That's the only way the body knows of protecting itself in that stressful situation. So all of those stressful situations that we talked about here has the same response on the body. And it takes the cortisol levels high, which then has effects on some of the symptoms that we see. So this is the reason why we're talking about that stress response is feeding into why we see kids. Okay, so kids that have a high stress response and they're in this sympathetic state of nervous system activity, we see digestive issues. Okay, so digestion is anywhere from here to here. So that might be reflux, it might be indigestion, it might be bloating, it might be diarrhea, it might be constipation. Okay, the reason being that stress response where the blood goes to our arms and our legs, the blood's diverted away from our gut. We don't need to digest that Mars bar immediately. We need to get away from the tiger. So the body prioritizes what it does, and the digestion is not seen as a priority. So that's fine if we're in that stressful state for 10 minutes or 5 minutes. If we're in that stressful state all day, every day, then all of a sudden we start to get digestive issues. As well as that, immune problems. So again, our immune system is a fantastic thing, but when there's a tiger chasing after us, we don't need to fight the bug that's flying around that might be causing us a cold. So our immune system is kind of diverted as well, and we start to see immune problems. So babies that are just pretty sickly, they go from one illness to the next. What would affect a child for maybe a week seems to affect their child for a month, okay, because their immune system is just not functioning correctly. Irritability, and this is by far the biggest thing that we see, or I see in clinic, is babies that just cry all the time. You just cannot settle them. They're just not happy. They're not happy when they feed. They're not happy when they haven't fed. They're not happy when they sleep. They're not happy when they haven't slept. Just irritable babies. And this is just one way that they present. We have, as particularly when kids get a little bit older, but you can see it in early stages, the ability to concentrate. Again, if you're highly stressed, you're going to be, what's going on? What's going around? You're not going to be concentrating on building blocks or revising for an exam. So it actually has been linked to things like ADHD and hyperactivity and hypersensitivity disorders. And then ultimately, because all of these things have been going on for a period of time, we then start to see problems with the developmental milestones. So if they're not crawling by a certain age, or they're struggling to sit up by a certain age, or they're 16, 17 months walking rather than 11, 12 months walking. Sometimes it can be absolutely normal. Sometimes it can be a sign things are not where we want them to be. And just to compare my two daughters, the first one, who was pretty healthy in every way, which way, walked at 10 and a half months. My second baby, Edie, that we talked about, walked at 17 months. And that can be the difference. Same parents, same upbringing. Yeah. So how do chiropractors assess babies? Because they are not just small adults. They are a completely different breed. I'm not calling your babies a different breed, but you get my point. So we have to assess them very differently as well. So we're looking for changes in position. So position of the head. Is it in a neutral position? Is it tilted to the side? Is it rotated? Is it tilted back? Positions of the arms. Are they holding them in a comfortable position? Tone. So tone is how much muscle activation is going on. So if we lift an arm up, we expect to see a little bit of resistance. If it's completely floppy, that's too little tone. If I'm lifting the arm up and fighting against every movement, that's too much tone. So we're feeling for how much tone is through the whole body. We're looking at the skin. So looking at the colour of the skin, how much it flushes, whether there's any marks on it, whether there's any puckering or any concerns there. Symmetry. Is the left side of the body doing exactly the same as the right side of the body? Is the skull symmetry correct? And I'll talk about this in a moment, but the skull can tell us a lot about what's gone on within pregnancy and also the birth. The strength. Talked about tone, but how much the muscles can actually work when we want them to work. Gross reflexes. So these are the things where people tap on the knee and you see the knee flick up. We want to see that. We will check the gross reflexes within the baby, but also we're looking at something called primitive reflexes. Now, I have explained a little bit about primitive reflexes to you. No, I'm not going to ask you. Don't worry. It's like, oh. So primitive reflexes, it's quite a hard concept to understand, but basically the baby develops certain reflexes during its incubation period within the mother. These are to aid survival in the first few weeks and few months of life. And over the first year of life, these reflexes start to get more adult-like. So we can check these reflexes over the first few months of life to see how well the baby's nervous system is developing. Okay, so we have specific windows for each of these primitive reflexes to check to see how neurologically developed they are and whether it's appropriate for their age. And if there is any deviation away from that, it can tell us a little bit about what may be going on with the baby. Okay, so they usually develop or usually integrate back into kind of adult type within 2 to 12 months. Now the grasp reflex, so this is if you stroke the baby's hand, they will naturally kind of grasp around it. And whenever you put a finger down and they go like that, everyone goes, oh. It's like, yeah, but there is a reason for it. And if that grasp reflex, which usually starts to integrate fairly early on, 3 or 4 months, if that is carrying on, then it's linked to things like poor handwriting or problems with dexterity, manual things with their fingers. The Moro reflex, so this is the kind of startle reflex. So if there's a loud bang or if you move them too quickly, they startle by arms coming out and then arms coming in. So it's like that movement, okay? And it's the earliest form of this kind of fight or flight response, protection. But if that's not integrating correctly, then we start to see links towards ADHD and hypersensitivity. Asymmetrical tonic neck reflex. So this is where we turn the baby's head and we see changes in the bending and straightening of the arms and the legs. And this helps with crawling. So if there's a problem with this one integrating, it can start to impact on crawling. And then spinal galant reflex. So this is where we stroke the baby's back and you'll see like a bit of a movement of the back. And this is actually to aid them getting out of the birth canal. Well, that's the theory. But if we have any problems with this one integrating, then we start to see problems with kind of toilet habits. So it might be a little bit of incontinence or bedwetting or irritable bowel. So it's really important for us to check all of those primitive reflexes. Now, why chiropractic? Okay, so chiropractic delivers very gentle, very specific movements to the spine. When we move the spine, it starts to send better messages up to the brain, okay, because we have lots of nerve fibers that are located within the spine, very neurologically kind of focused. When we start to do gentle movements through the spine, it sends better signals up to the brain, and then the brain can better control movements, coordination, balance, and this is something called proprioception. Now, proprioception is basically our body or our brain's awareness of where our body is. Okay, so if you close your eyes, you can touch your finger with your nose because your brain knows where your finger is and it knows where your nose is and it can coordinate movement. So if we've got good proprioception, we have good balance and movement and control. So the more we can speed that up, obviously the better. The cerebellum also feeds into that stress response. So we talked about all of those stresses earlier. The baby's in a really stressed state. We can do adjustments to the spine and it actually lowers that stress response. Makes everything calm, helps us to go from that kind of fight or flight response more into what's called rest and digest. So instead of having a hyperactive, awake, irritable baby, we see a restful, a peaceful baby who digests their foods better. So improved proprioception leads to a coordination of that stress response being reduced. And this state of the nervous system, instead of being called the sympathetic state, we're now into the parasympathetic state, which is the rest and the relaxing. And it brings those cortisol levels right the way down, and everyone gets the benefit of it. So the techniques that we do, or I do, there's a few focuses. We will look at the spine itself. If we have any areas of the spine that are not moving correctly, we make the adjustments to improve that movement. Mostly that is from a touch and hold technique. So you've seen the videos of adult chiropractic and there's this crunch, crack, crick, none of that. Okay, so it is not what you think for babies. So a touch and hold, it's using fingertip pressure. We apply it onto the areas that need adjusting and it will be a small pressure and hold. And after a few seconds, we start to feel that tissue just give and relax. Okay, and that's what we're looking for each of those spinal adjustments with the touch and hold technique. We have visceral releases. So this will be applying, again, fingertip pressure, mainly along the points of the digestive system. So there's various points on the digestive system that have the effect to kind of block or slow movement of that digestion down. So we'll be putting fingertip pressure in again. And if you can imagine standing on a hose that's running, if you stand on the hose and you leave it for long enough, the pressure starts to build a little bit behind the hose, yeah, behind where we're putting the pressure. So we put the pressure on, builds a little bit of pressure, and then we release quickly, and it's like a flush of the digestive system. So there's various points that we will do, which are called a visceral release. We also have cranial. So the cranial work is to, if you imagine the tectonic plates on the earth, they're kind of floating a little bit and they have the ability to kind of move, and that's when we see kind of tsunamis and stuff like that. We're not going to get tsunamis, but imagine the plates, the skull in an infant of like these kind of age, they are mobile. So when the baby comes through the birth canal, these plates kind of shift and move and go over each other to allow that space to get through. Now, sometimes these cranial plates don't sit back into the right position, so they need a little bit of encouragement to get those cranial bones moving correctly. Again, very, very gentle. It's just applying fingertip or gentle hand pressure, and it will be maneuvering them into the correct position. Also the jaw. So the jaw is particularly important, obviously, to open, to be able to get onto the breast or the bottle, whatever. And if the jaw is asymmetrically moving, and we have a good movement on one side and restricted on the other, they generally have problems with opening and latching on properly. So with the jaw techniques, it would be a very gentle downward pressure inside the mouth to maneuver that jaw open and closed. And then leading up to kind of, I tend to have a bit of a cutoff of about 5 years old, and we can lead up to kind of the adult clicks and cracks and the proper adjustments. With my kids, they've had it right from from being about 1. So it's absolutely safe. It's just some kids do not like it, so we have to maybe time it correctly. Then it might be into rehabilitation, getting them doing some exercises that may kind of free off or tighten things up that we need to. And then the primitive reflexes, there may be some exercises that we give to help those primitive reflexes integrate properly. Okay, so safety, incredibly safe. Okay, there's no substantial research that says that anything about chiro being unsafe. So unfortunately, there's quite a bit of, I say propaganda, that sounds really harsh, but people with an ulterior motive kind of say things, oh, it's not safe for kids, and all. It is absolutely safe. The forces involved, so for a natural labour, we're about 54 newtons of pressure on the skull and the baby's spine. When we end up with a ventouse delivery, that jumps up to 113. So it's a massive increase. And you can imagine that, I mean, it's a suction pressure. And that's why we see the babies with kind of the cone-shaped head, because of the forces that are involved. But it's not just here. It's pulling here, it's pulling here, it's pulling here, because everything is connected. But when we're doing the chiropractic adjustments, it's 2 newtons. So that's how much difference there is in the forces that we're using. And it's about the same pressure as checking a ripe avocado. So just finishing off with a bit of an example. We see this, well, I see this probably on a weekly basis. You can see the flattening of the skull here. And generally, when I question parents about it, it's like, oh, well, they just prefer to be that side, or yeah, they lay in the cot and they want to be facing me, so they lay on the right hand side. But the pressure gives a flattening of the skull. But what this actually is called is a plate strain. And it's very, very common, like I say, but it can be a sign of undiagnosed upper neck issues. Because they're favoring one side rotation, they struggle to get over to the other side, and then we don't have even pressure. They have difficulty rotating to one side, and they quite often have difficulty feeding from one breast compared to the other. And the mother generally says, oh, well, it's just that he prefers that breast, or I think it's because I've not got good supply in this one, but I have in this one. And it's not. It's because the baby's struggling to get a good position, a good latch onto the other breast. They're not then having effective suck, and it's all about supply and demand. And if this breast is just not getting stimulated to produce enough milk, the other one's going to be much better. Okay, so once we start freeing off that upper neck and allowing free movement, then we can start to correct the skull, and we see the evening out of the skull flattening. Okay, so just closing thoughts. I am nearly done. Children are exposed to ever increasing stress. Okay, hopefully from this presentation you'll understand where those stresses come from. Some we can limit, some we can't. It's life. These things happen. But what we can do is make sure that we're helping them in any way we can. I believe that children need natural interventions first, instead of going the route of drugs and surgery. Again, when people come in, they may even be on indigestion medication at that point. And it's not about getting them off that, but it's also about helping to the point where hopefully they don't need that medication anymore. So I would like to get the word out that we go natural rather than drugs first of all. I believe that chiropractic can directly improve the health. So it's not all about the symptoms. Okay, when we start doing the care, hopefully we'll see some improvements in the symptoms. But more importantly, it's the function. And if the function is working correctly, the rest will take care of itself. We are well trained, knowledgeable, and able to give excellent all-round care. That's quite hard for me to say because I'm not someone who puts them in, but I believe that every paediatric chiropractor, as long as they're well trained, has this potential to make massive changes. Thank you. Do we have any questions? You can either ask in the group, or if you've got time afterwards, I'm more than happy to answer on a one-to-one basis. Any questions first of all? No, we're good?
Yeah, we've got about 15 minutes if people
Yeah.
want one. We're also offering 20% off initial consultations with Jim. So, Jim, do you want to talk through like the consultation process?
Yeah, so the consultation,
Yeah.
yeah, so the consultation, you'll get a form emailed to you which details a lot of kind of what's happened during the pregnancy. The more information you can get onto that, the better, because it just gives me more information to go on. The consultation process, I will run through that form prior. We'll get you in and we'll run through everything that's gone on within the pregnancy, any concerns that you have, and then it will obviously be the full examination process. We'll do all of those checks that we did when I said about assessing. We're looking at the tone, the primitive reflexes, the movement, and how the spine and the pelvis is feeling. After that, I will write the case up, make sure it's something that we can deal with and we can get effective benefit. And then on the next session, I'll run through all the findings that I've got, and then we can start doing the treatment. Okay.